We were talking about respiratory diseases. Let's continue from here. Emphysema happens when the lung becomes so distended and inelastic that gas exchange is hampered. Chronic obstructive pulmonary disorder is a permanently, or COPD, is a permanently damage to the lungs and brings emphysema, and is a type of emphysema also is a type of a chronic obstructive pulmonary disorder. This happens to smokers. This respiratory problem. The lungs are damaged. That's it, and the person cannot breathe by itself. Sometimes they need a tank of oxygen, carry a tank of oxygen everywhere. Asthma is triggered by allergens. You know asthma. We have talked about asthma before, about all the medications, salbutamol, albuterol, ipratropium, medications for nebulization, asthma crisis, when the interchange of oxygen in the alveoli is obstructed by this inflammation process caused by allergens. Sleep apnea. Apnea is interrupted breathing, often occur during sleep, can contribute to snoring. Apnea in the elderly are a mechanism for sensing changes in gas levels that become less effective with age. Apnea in the obese is fat deposits in the neck that obstruct the airways. Pathogens and cancer in the respiratory system. Pneumonia is an infection that inflames the lung tissue. Fluid builds up in the lungs, making breathing difficult. Can be triggered by influenza or Streptococcus pneumonia. H1N1 flu virus can affect the lungs too. Severe acute respiratory syndrome, SARS, also the COVID-19. You know everything about COVID-19 already. Another respiratory pathogen is tuberculosis. It's a lung infection caused by bacterium, Mycobacterium tuberculosis. The lung cancer is a compound in tobacco, smoke, and coal tar converted to carcinogens. 4 types of lung cancers you have, and the most aggressive type is a small cell carcinoma. Talking about cancer, last night I received a text message and even a call. I couldn't take the call. I was busy with my brother visiting like for 1 week from Dominican Republic with his wife. But last night I received a text message. We still have 9 minutes for the class. From a friend, a good friend, that he was telling me in the text message. He first sent me the description of an X-ray of the thorax, and in the description I was able to read about inflammation of some lymphatic nodes in the thorax area, like in the mediastinum area, near the lungs, or near the lung. And what that meant was that this dear friend have a very aggressive type of cancer in the lungs. He knows, like from 2 months ago, he was just texting me last night that maybe in 2 weeks, something like that, he's gonna have a surgery for the cancer and a chemotherapy. And cancer can happen to anyone, and it's a very difficult disease. That was a very sad news that I got last night. I was able to call him this morning, and he's like very. He says he's not depressed. He's praying for his health, and he's fine. But I know that is kind of the biggest challenge in life. One of the biggest challenge when you're facing a terrible disease like cancer. Uh, Healthcare professionals have to deal with this disease and this type of patients, and it's very challenging. The respiratory system in homeostasis. So when the respiratory system, when everything is fine, there is no disease, everything is working well. What happens when the respiratory system is okay is that the airways and lungs bring air, deliver oxygen to the bloodstream, transport it to all living body cells. Exhale the air, eliminates waste and carbon dioxide. The body mechanism adjusts respiration as needed to keep body in homeostasis. Guys, this is the end of this PowerPoint.